terms of treatment for this, it's actually multi-factorial, meaning that it's not just only giving medications. We institute basically like a three-prong approach in terms of getting patients to make sure that they exercise, make sure they get the proper sort of support, for instance, such as a cane or a walker, having a toilet seat that's elevated if they have knee osteoarthritis, getting them to see physical therapy, making sure they're doing the right exercises to strengthen their muscles. Particularly for the knee osteoarthritis, which is very common because it's a weight-bearing joint, we want them to strengthen their quadricep muscles, which will help with the osteoarthritis and the pain that they can develop just by strengthening that. So then the next step is obviously, doing anti-inflammatory agents or pain medications. So we also give steroid injections, corticosteroid injections into the knee, which helps with the inflammation and pain, but that's only done about 3 to 4 times a year for safety reasons. And there's now this new agent that came out within, I'd say, past several years where there's a lubricant that you can inject. It's a hyaluronic acid derivative into the joint. And the thought process is, your joint is basically a cushion in between by cartilage, and with time that can degrade, and you can imagine with the degradation there's a little bit more pain, and sometimes it can be severe enough that the bone is actually on top of bone, and so it causes a lot of pain and therefore reduction in range of motion. So if the pain is so severe that despite getting anti-inflammatory agents and pain medication, the pain is reducing a patient's ability to do their basic things in life, we actually send them to the orthopedic surgeon where they can be considered for knee replacement or arthroplasty. But there's a whole wide spectrum, and there's a lot of new things that are being investigated in osteoarthritis.